Hello, my name is Timlolu Ajike from University of Lagos's Psychology Department, Year 4, and welcome to Health Psychology 2. In this video, we will discuss research in health psychology, goals of health psychology, beliefs about health, and beliefs about illness. If you would like an introduction to health psychology and its theories, please refer to the video Health Psychology 1. Let's talk about the research process in health psychology. Health psychology is an empirical science and, as such, makes use of the scientific research process. This involves specifying an issue, problem, or hypothesis, that is, pointing out a problem that is common in society or that you think needs to be addressed, or proposing the connecting principle in a topic. For example, you want to talk about social media and body image satisfaction, and you want to see what the impact of social media use is on body image satisfaction. And then you could say, okay, my hypothesis is that there is a significant impact of social media use on body image satisfaction among young adults. Then you develop an operational definition. That is, what is social media use? Do you mean the use of social media for up to 18 hours in a day? Do you mean the use of specific apps like Instagram or instant messaging apps like WhatsApp, which could also be classified under social media use? Or do you mean the use of social media applications that are specifically designed for meeting new people, like dating apps? Then, how do you operationally define body image or body image satisfaction? Do you mean believing that they are beautiful or believing that they fit societal standards? You need to define what exactly each of your variables mean. Collecting data. How do you want to go about gathering this information to make your research respectable? Analyzing data. What analytical methods do you want to use? What statistical methods do you want to apply to make sense of the data you've collected? Working with existing theory by redefining or commenting. That is, you do your literature review. You read up on what is available concerning this topic. What do people know already? Do you agree with what they've said? Do you think it needs to be worked on? What are your comments? And finally, you could as well formulate a new theory and say, based on my findings on the impact of social media use on body image satisfaction among young adults, it can be said that so and so and so. It's a way to predict the outcome based on your study of your hypothesis. We have two types of research methods: the quantitative methods and the qualitative methods. The quantitative methods are used to gather and process numerical data. For example, experiments like RCTs, those are random controlled trials. They're used to manipulate variables, determine the causes and effects in relationships. Correlational studies. So notice that correlation is not causation. So while correlational studies help examine relationships between variables, experiments check causation. They manipulate variables to find out if one thing truly causes another. So experiments find out causation, correlational studies find out prediction. That is, because these two variables relate, we can use this to predict the other, but not necessarily cause the other. Surveys to gather data, response on attitudes, beliefs, behaviors, and reduce them to numbers, like using a Likert scale. Longitudinal studies. These are taking of the same individuals over a long period of time. That is, you could study how health habits in adolescents impact adult health. You could get the participants when they're really young, let's say when they're 17, 18 as adolescents, and study them and monitor them till they're in their 40s. That's about 30 years of studying. And finally, we have meta analysis, combining results from multiple studies for a stronger conclusion. You see things like this in a systematic review, where you gather all sorts of literature, all sorts of information, all sorts of empirical studies, and gather them to draw up a conclusion based on these various studies. The qualitative methods, on the other hand, are used to gather and process non numerical data. For example, interviews. These are in depth conversations used to explore individual experiences. For example, if you want to understand the challenge of managing a chronic illness, you ask them it could be semi structured where you have some pre planned questions and then you have some open ended questions and then you have the opportunities for them to say any extra thing that they feel is important. We also have focus groups where people sharing similar experiences or relatable experiences come together to have group discussions. For example, exploring community attitudes towards mental health. Observations, where we study the behavior of people in their natural settings, like with behavioral mapping, where you have an expectation of what should be done in this environment and you check to see if or if not it takes place. You also use that opportunity to map new behaviors that you were not expecting to see that took place there often enough. Then textual analysis. This is like analyzing written materials and sort of doing a thematic analysis where you try to draw the similarities across these texts to come up with group words or umbrella terms to classify these materials. Other than the two main types of research methods, we have the mixed methods and other methods. Mixed methods is basically combining the qualities or the traits of the quantitative methods and the quantitative methods to have a more complete understanding of your data. For example, you could use surveys to gather data on health behaviors, followed by interviews to explore the reasons behind those behaviors. And then other methods include ecological momentary assessment, which is real-time data collection in daily life. This is usually done with the help of a digital application where you constantly monitor the experiences of a participant or an individual in real life situations as those situations are taking place. We also have psychophysiological methods, measuring physiological responses like your heart rate or your hormones in the middle of a situation. And finally, we have neuroimaging, which is studying brain activity related to health and behavior as your health is taking place. So, if they want to see the way the brain of a sick person looks when compared to the way the brain of a healthy person looks, this could help draw comparisons and see which parts of the brain are active, which parts of the brain are affected. The overall goal of health psychology is to alleviate or prevent patients' physical symptoms and improve their lives. The focus is not the illness, but the patient. This goal can be broken down into 8 major goals: preventing illness, conducting research on prevention and intervention of health problems, investigating the effects of disease, finding treatments to manage pain, understanding behavioral and contextual factors for health and illness, providing critical analysis of health practices, improving doctor-patient communication, and improving adherence to medical advice. Health beliefs encompass all beliefs related to health, well-being, disease prevention, health behaviors, risk factors, healthcare systems, and even general concepts of health and wellness. They are not necessarily accurate or factual, but they are real to the individual and can significantly influence their health-related behaviors. These beliefs can be based on personal experiences, cultural background, information from healthcare providers, media messages, and social influences. If you remember the theories treated in Health Psychology 1, the health belief model and protection motivation theory are very key in understanding health beliefs. Significant contributions were made to the health belief model proposed by Hochbaum and his co-researchers through the work of Leventhal, Mayer, and Nehrenz in 1980 and in 1985. Illness beliefs is a set of a patient's own implicit common sense beliefs about their illness. These beliefs provide a framework or schema for coping with and understanding an illness with the aim of returning to normality, that is, being able to accomplish your daily functions without any physiological hindrance. The motivation to attain normality can be understood by the self-regulation model of illness behavior, also known as the common sense model. This model examines the relationship between someone's cognitive representation of their illness, that is, their illness belief, and their subsequent coping behavior, that is, their illness behavior. In essence, what we think affects what we do to get better. Initially, illness beliefs were only seen as a cognitive representation, but with later definition, it was emphasized in its role in self-regulation and coping. According to the self-regulation model, there are 5 dimensions of illness beliefs: identity, causes, timeline, consequences, and curability and controllability. Identity refers to our understanding of what the illness is about, where the illness is from, what the illness means to us based on education or cultural background. Causes, as I said, refers to the causes of the illness, what made the illness come about, what makes a person contact such an illness. Timeline, which is how long will a person suffer this illness? What is the regular course of this illness? And if you were to be treated, how long does it take to be treated? And if you were to be treated, is it possible to relapse? And how long would it take before you relapse? Consequences. What are the consequences of this illness? How can it affect one's life? That is, if untreated, of course. Even if it was treated, like with cancer. If you treat cancer, it has consequences. If you don't treat cancer, it has consequences. Either way, one has to look at the consequences an illness has on their life. Then, curability and controllability. To what extent can I control this illness? To what extent can I control the effect of this illness over my life? To what extent can I actually cure this illness? That is this illness terminal? Is this illness surely going to kill me? Am I just trying to settle for palatable living where they just make me live a comfortable life till I die? Or is this something I'm really going to get cured from? These are the dimensions of illness belief. Thank you very much for paying attention through this video. And like I said, see you in Health Psychology 3.